Anchovies are often promoted as a healthy, flavorful food because they are rich in omega-3 fatty acids, provide calcium when eaten with their bones, and add intense umami with very small amounts. From a gout and high uric acid perspective, however, anchovies are one of the most problematic foods you can choose, and their risks are frequently underestimated precisely because they are eaten in small, concentrated forms such as canned fillets, pastes, sauces, or pizza toppings. Weight for weight, anchovies rank among the highest purine foods commonly consumed, and this makes them especially dangerous for people who already struggle with uric acid control. The central issue is purine density. Small oily fish such as anchovies have extremely high concentrations of nucleic acids because of their muscle composition and metabolic activity. When digested, these purines are rapidly converted into uric acid. Even a modest serving can cause a significant spike in serum urate, and because anchovies are often eaten in salty, preserved forms, they may also contribute to dehydration, which further impairs uric acid excretion by the kidneys. For someone with gout, this combination can be enough to trigger an acute flare within hours or days, even if the overall meal does not seem excessive in calories or protein. Another important risk factor is how anchovies are typically consumed. They are rarely eaten fresh and plain. Instead, they are commonly salted, oil-packed, or fermented. High sodium intake can worsen fluid balance and blood pressure, both of which are linked to poorer kidney function over time. Reduced kidney efficiency means uric acid remains in the bloodstream longer, increasing crystal formation in joints. In addition, anchovies are often paired with alcohol, refined carbohydrates, or rich foods such as cheese and processed meats, all of which can amplify inflammatory responses and further increase gout risk. This context matters. Anchovies are rarely an isolated exposure, and their effects are magnified by the dietary patterns they usually accompany. While anchovies do provide omega-3 fatty acids, which are generally anti-inflammatory, this benefit does not cancel out their purine burden for gout-prone individuals. The amount of omega-3 obtained from anchovies can be easily replaced by lower purine options such as salmon in modest portions, trout, sardines in limited amounts, still not ideal but generally lower than anchovies, or even plant and algae-based omega-3 sources. Relying on anchovies for omega-3 intake is a poor trade-off when the cost is a substantially higher risk of painful joint inflammation. There is also a cumulative risk to consider. Gout is not only about single meals, but about long-term uric acid exposure. Regular use of anchovies as a topping, flavoring, or ingredient in sauces can quietly raise baseline uric acid levels over time, even if no immediate flare occurs. This chronic elevation increases the likelihood of future attacks, joint damage, and tophi formation, and may also contribute to cardiovascular risk, which is already higher in people with gout. Because anchovies are so concentrated, even small amounts used frequently can have outsized metabolic consequences. During an active gout flare, anchovies should be completely avoided. At this stage, the immune system is already reacting to urate crystals, and adding a high purine food can prolong the flare, intensify pain, and slow recovery. Even between flares, many clinicians recommend avoiding anchovies entirely if gout attacks are frequent or uric acid levels are consistently elevated, because the margin of safety is very small. In practical terms, anchovies are best treated as a high-risk food rather than a health food for people with gout or hyperuricemia. If they are used at all, it should be in extremely tiny amounts, infrequently, and never during flares. For most individuals in this risk group, it is safer to eliminate them altogether and replace their flavor contribution with alternatives such as herbs, spices, lemon, capers in moderation, or small amounts of lower purine fish. While anchovies may be nutritionally interesting, their purine load, typical preparation methods, and strong association with gout triggers make them a poor choice when long-term joint health and uric acid control are priorities.